When kids get their hands on their parents' weed, it can lead to visits to the emergency room. But a new state law appears to be helping with the issue. The law regulates the production, sale, and potency of THC in Virginia. And one doctor at CHKD says they're now seeing fewer kids accidentally stoned and needing help. From high to low, the number of children needing to go to the hospital for cannabis exposure dropped 14% last year in Virginia and 16% at Norfolk's Children's Hospital of the King's Daughters.
Because some of the ones that get really sick, it's really unnecessary.
Health experts note the decline coincides with a bipartisan law that took effect on July 1st, 2023. It established health and safety standards for the retail sale of THC and hemp-based products. Some of those are sold in packages that kids sometimes mistake for candy.
People that this law will really help save are the younger kids who get into this mainly because they're ingesting accidentally. These substances look very similar to candy, to chips, to gummies.
Dr. Faika Qureshi at CHKD says the symptoms can vary. For mild exposures, doctors might watch the kids for a couple hours, then send them home. But for the more severe ones,
they are having problems with low blood pressure, they're not breathing as well, they're not responding as well, they're having a seizure. Then those we have to admit and give IV therapy, we may have to intubate them, we may have to give them medicine for their blood pressures, and that would be the more severe exposures.
And Dr. Qureshi says it's also important to educate parents about the dangers of keeping marijuana around kids and for those who use to lock up their stash.